This channel serves to educate and inform, yet it doesn't replace expert medical counsel. Remember, your medical queries and concerns should always be directed to a professional. Diagnosis, treatment, or any health-related advice? Seek the wisdom of your physician or a qualified health provider. Let this be a springboard for learning, not a substitute for professional guidance. Dive in, absorb, but always consult with the experts for your health matters.
Did you know that 1 in 2 men and 1 in 3 women in the US may develop cancer? A stark reality, isn't it? But what exactly is cancer? Cancer isn't just one disease, it's a group of diseases, all characterized by the uncontrolled growth and spread of abnormal cells. Imagine your body as a well-oiled machine, where each cell knows its role, dividing and dying at a controlled pace. But sometimes this harmony is disrupted. Some cells decide to rebel, multiplying uncontrollably, and this, my friends, is where cancer begins. Now you might wonder, what triggers this rebellion? The answer lies in our genes, the blueprint of life. Mutations in these genes lead to abnormal cell growth. These mutations might be inherited, or they might occur during your lifetime due to various factors like exposure to harmful radiation or certain chemicals. Cancer symptoms can be as varied as the types of cancer themselves. They can be subtle, almost whispering their presence, or they can be loud, impossible to ignore. Either way, these signals our bodies send us should never be dismissed. Let's start with one of the most common warning signs: unexplained weight loss. Have you ever lost a significant amount of weight without trying? While this might sound like a dream to some, it could potentially be a red flag. Significant unexplained weight loss can be a symptom of certain types of cancer, including lung, pancreatic, and stomach cancers. Next, we have prolonged fatigue. Everyone feels tired from time to time, but this is a different kind of fatigue. It's a bone-deep exhaustion that doesn't improve with rest and might even worsen with time. This could be a sign of various cancers, such as leukemia or colon cancer. Now let's talk about our skin, our body's largest organ. Changes in the color, size, or shape of a mole or freckle may indicate skin cancer, but skin changes aren't limited to moles. Yellowing of the skin, known as jaundice, could signal liver cancer, while darkening or reddening of the skin could be symptomatic of other cancers. Persistent pain is another symptom that should prompt a visit to the doctor. While it's common to experience pain now and then, pain that doesn't go away or improves with treatment could be a sign of certain cancers, such as bone or ovarian cancer. Remember, these symptoms do not necessarily mean cancer. Many are much more likely to be caused by less serious conditions, but they should not be ignored. If you experience any of these symptoms for an extended period, it's crucial to seek medical evaluation. Recognizing these symptoms can be the first step towards early detection. But how do we confirm a cancer diagnosis? Diagnosing cancer involves a combination of physical exams, blood tests, imaging studies, biopsies, and genetic testing. Each of these tools plays a crucial role in painting a complete picture of a patient's health status and the potential presence of cancer. Physical exams serve as the first line of defense. Doctors meticulously observe for any anomalies in the body that might suggest cancer. They look for lumps that could indicate a tumor or abnormal sounds in the lungs that could point towards lung cancer. Blood tests provide a snapshot of the body's overall health and can hint at abnormalities. For instance, high levels of certain proteins or white blood cells could suggest that the body is fighting an unseen invader, possibly cancer. Imaging studies like CT scans, MRIs, ultrasounds, and X-rays allow doctors to peer inside the body, offering a detailed view of organs and tissues. These images can reveal tumors or unusual growths that might be cancerous. Biopsies, where a small sample of tissue or cells is removed and examined under a microscope, can confirm or rule out a cancer diagnosis. This procedure can help identify the type and grade of cancer, providing valuable information for determining the best treatment approach. Genetic testing is a more recent addition to the diagnostic toolkit. It can reveal gene mutations that might increase the risk of certain types of cancer. This information can guide preventative strategies to reduce the risk of developing cancer. Once a diagnosis is underway, doctors use a system known as TNM to stage the cancer. The T stands for tumor size, N for node involvement, and M for metastasis or spread of cancer to other parts of the body. This staging system helps doctors plan the most effective treatment strategy. Once a diagnosis has been made, it's time to discuss management and treatment options. The journey to recovery begins with understanding the enemy within. The more we know, the better equipped we are to fight back. Cancer treatment is a multifaceted approach that includes surgery, chemotherapy, radiation, and immunotherapy. Each of these methods is uniquely designed to control or even eliminate the disease, but they also work together in a harmonious ballet of medical intervention. Surgery is often the first line of defense. It involves the physical removal of the cancerous tissue, aiming to eradicate the disease at its source. But surgery isn't always enough. Sometimes the disease has spread, or some cells might remain unseen and undetected. That's where chemotherapy steps in. This powerful treatment uses drugs to kill cancer cells throughout the body. It's like a vigilant soldier always on guard, ready to attack any cancer cell that dares to show its face. Radiation therapy, on the other hand, uses high-energy particles or waves to destroy or damage cancer cells. It's like a sniper, precisely targeting the enemy and sparing as much of the healthy tissue as possible. And then there's immunotherapy. This innovative treatment boosts your body's own immune system, empowering it to recognize and destroy cancer cells. It's like training your body to be its own superhero, ready and able to fight off the villainous cells. But these treatments, while effective, can often come with a heavy toll. Side effects can range from fatigue and nausea to more severe issues like organ damage. This is where palliative care comes in. Palliative care specialists work to manage these side effects and improve the quality of life for patients undergoing treatment. They're the nurturing caregivers, providing comfort and relief in the midst of the battle. While treatment is critical, self-care also plays a crucial role in living with cancer. It's about nurturing yourself, physically and emotionally, through this journey. It's about taking care of your body, your mind, and your spirit so you can face each day with strength and resilience. Because in the end, living with cancer is not just about surviving, it's about thriving. Survivorship begins at diagnosis, and self-care is a key component of this journey. It's not just about surviving, but thriving, and self-care plays a pivotal role in this. It's the little things we do for ourselves that can make a big difference. Self-care may seem like a buzzword these days, but in the context of cancer, it takes on a whole new meaning. It's about maintaining a balanced diet because what we put into our bodies matters. It's about ensuring we get the nutrients we need, while avoiding those that might fuel the disease. It's about staying physically active because movement, even in small doses, can boost our energy, improve our mood, and strengthen our bodies. It's about finding the type of exercise that works for us, whether that's a brisk walk, a yoga session, or a dance party in the living room. But self-care isn't just about the physical. It's also about managing stress. That might mean meditating, journaling, or talking to a therapist. It might mean making time for hobbies that bring us joy, or spending time with loved ones who lift us up. And of course, it's about getting adequate rest. Sleep is when our bodies heal and regenerate. It's when our minds process and decompress. It's a fundamental pillar of health, and one that's often overlooked. But even with the best self-care practices, there remains the potential for cancer recurrence. That's why regular follow-ups are crucial. These appointments are an opportunity to catch any changes early, when they are most treatable. They're a chance to ask questions, to voice concerns, and to stay informed. Survivorship isn't a destination, it's a journey. And like any journey, it can be challenging. But it's also an opportunity for growth, for resilience, for transformation. It's a reminder of our strength and our capacity to adapt. Remember, early detection and innovative treatments can significantly improve survival rates, so stay informed, stay vigilant, and always consult with your healthcare provider about any concerns.